Mr. Chairman.
Representative Carpenter.
Thank you, Mr. Chairman. I have a bill, RS 1048. It's a bill concerning health care related to the Secretary of Disability and Aging Services peer support services, establishing a peer support specialist certification standards, requiring a background check for certification, directing the Secretary of Health and Environment to pursue a Medicaid code for telehealth services provided by peer support specialists.
Did we get all that? Good, okay. Okay, in committee, before we dive right into bill, it's been a day. Have a bill introduction, any objections? Okay, bill's introduced.
Thank you.
Thanks for keeping me straight. Okay, so before we dive into the recommendations for KDHE, I handed out to each of the committee members it's a spreadsheet, in essence, with the public testimony request that came in for the KDAD's budget. So I know we've got a lot of work coming up on that particular budget. As I'm learning this process and getting better at it, I wanted to make sure everybody had this in front of them so you can take a look at Dayton's work for us. So that is for your use for tomorrow. Okay. So let's dive right in. This hearing is on recommendations for the Kansas Department of Health and Environment. Do I have any recommendations? Representative Oropeza.
I have a recommendation for FYI 2025 to support the 30 FTEs that are being entirely federally funded. Oh, I'm sorry. I have a recommendation to support the 30 FTEs that are being entirely federally funded that were requested. It's not the total of 46, but the 30 that were completely funded through the federal programs, grants.
I have a second, excuse me, have a recommendation, a second from Representative Ballard. Any discussion? No discussion. So I have a recommendation and a second.
Can we have a breakdown?
Representative Rivas.
What's the breakdown on the what the FTEs are for? There were some of those had departments listed, some did not.
Do we have somebody here from the agency?
I think we do. Welcome to committee.
Hi, Ashley Goss, Deputy Secretary for Public Health. I think what you're referring to are the positions that were requested to maintain for our disease intervention specialists. So that fund our disease investigators for communicable diseases such as syphilis, HIV, and any other sexually transmitted disease is what that number is. We had received a 5-year funding allotment from the federal government, and they clawed that back last year, I believe it was, and they cut off years 4 and 5 for us. And so they cut it off fast enough to where we have not been able to identify additional funding. If we do not have these positions in our budget, then that type of work is going to be hard pressed to be able to do because the local health departments do not have the capacity to do this work.
Okay, does that answer the question? Thank you. Okay, committee, do I have any other questions? Okay, I have a motion and a recommendation and a second. All those in favor say aye. Aye. All opposed? Recommendation passes. Okay, continuing on. Do I have any other recommendations? Representative Steens?
I have a few. Thank you, Mr. Chair. Yes, first, Mr. Chairman, I move the committee increase the vagus nerve stimulation, the VNS Medicaid rate for new implants, and that's code CPT 64568 to 40,000, and the VNS reimplant Medicaid rate, which is the CPT code 61855 to 30,000.
Okay, I have a recommendation. Do I have a second?
I'll second that.
Representative Rivas? I have a recommendation and a second. Any discussion? Representative Ballard?
Just explain that again, please. I got the vagus nerve part.
Yeah, so that was the vagus nerve stimulation. That is the life-changing, the drug-resistant for epilepsy patients, Representative, and that was for the implant Also, the request to increase the Medicaid reimbursement rates to $40,000 for implants and $30K for the reimplants.
Any other discussion, questions? Okay, have a
So-
go ahead.
Sorry.
Representative Orpeza.
I'm sorry, I do have
good.
a question. So does that add, how much is the cost on that?
Well, are you talking about what the current rate is and what it's raising up to?
Yes.
Okay, so the current implant rate is $21,840, and the re-implant of one with a dying battery is $10,000. And apparently those rank 42nd lowest in the nation.
And the total cost?
So right now, we're going back to $40K for the implants and $30K for the re-implants. Oh, I'm sorry, the SGF request is $420. But there are savings anticipated greater than that amount.
Okay, thank you.
Any other questions? Okay, I have a recommendation and a second. All those in favor say aye. Any opposed? Recommendation passes. Do I have any additional recommendations? Representative Rivas.
Thank you, Chairman. Yes, I've got one for the, I passed out a few informational pieces, Medicaid dental rates. My recommendation is a 16.9 million SGF, which, sorry, Mark, is that close enough? Is that better? So it's 16.9 million SGF, which is a total of 44.3 million with the federal match. It'll raise the rates in Kansas to be a meaningful increase to get to at least a value where at least the more providers will be able to provide care. This, in conjunction with Oral Health Kansas's facilitator program, we're hoping we'll get a big increase in the number of dental Medicaid providers. I would also add to that I'd like to include a study in 3 years to assess how well it's doing, to make sure it's delivering.
Okay, thank you. Any other questions for Representative Rivas? Representative Carpenter?
Thank you, Mr. Chair. We have spent a lot of time and money on dental rates over the last 4 or 5 years. And I'm not saying that this isn't a good thing. I'm just saying it's a very big lift, is what I'm saying. 16.9, $17 million. You know, I just think it's a huge lift, given the atmosphere we're in. So I'll just say that.
Okay, any other comments for Representative Rivas? Okay, I have a recommendation, a second. All those in favor, say aye.
Aye.
All opposed? No. Chair is in doubt. All those in favor, raise your hands, please. 1, 2, 3, 4. Recommendation passes.
Thank you.
Okay. Continuing on, additional recommendations.
Mr. Chair?
Representative King.
Yeah, I have a recommendation for fiscal year '26 to add $263,000 to support services provided by the Cerebral Palsy Research Foundation of Kansas and Wichita. And again, this is fiscal year '26.
Recommendation, do I have a second? Representative Ballard. Any questions or discussion on the recommendation? All right. All those in favor say aye.
Aye.
All opposed? Recommendation passes. Continuing on, do I have any additional recommendations? Representative Orpeza.
I have additional recommendations as well, but we'll start with this one. For FYI 2026, the 30 FTEs that are entirely federally funded, to make sure those continue into 2026. It'd be the same thing that Secretary Goss spoke of.
Okay. Okay, I have a recommendation. Do I have a second? Representative Ballard seconds. Any discussion? Okay, so clarification, this is FY '26. The first one was okay.
Sorry, 2025, yes.
Okay, so we have a recommendation and a second. Any discussion?
Just to verify, this is all federal funds?
Question, is this all federal funds, Representative?
Yes,
Ortega?
this is all federal funds, and there's no cost to the state, the way it was presented.
Okay. Have a recommendation and a second. All those in favor say aye.
Aye.
Any opposed? Recommendation passes. Okay, continuing on, Representative Reese, did you have one? Representative Reese.
Thank you, Mr. Chair. This, I assume, would just require the committee just to say that we recommend it. So this is the this is for FY 2026, sorry. Recommend the elimination of prior authorization for complex rehab technology, parts and repairs, as requested by the National Coalition for Assistive and Rehab Technology. There was no dollar amount attached to that, but it's asking KDHE to eliminate the prior authorization for those parts.
Okay, I have a recommendation. Do I have a second?
I'll second that.
All right, Representative Steens was first. Any discussion?
Fight over it.
Representative Carpenter.
Thank you, Mr. Chairman. So I might, just for discussion, if you remember the testimony from the wheelchair folks, and they have to drive out there, and they've got the parts on their truck, and they could fix it right then, but no, they have to drive back, file a pre-authorization, get that back in a month's time, and then go back out there. So it's just absolutely ridiculous. I'm not sure we have the authority to recommend this, but I think it will start the discussion, and we have CanCare oversight next week on next Friday on the 15th, and they already know that that's going to be, the MCOs already know that's going to be a topic of discussion. So thank you.
Okay, we have a recommendation and a second. Any further discussion? All those in favor say aye.
Aye.
Any opposed? Recommendation passes. Okay, moving right along. Representative Steens, you have a recommendation?
Yes, so following along those same lines, Mr. Chair, I would like to recommend for fiscal year 2026 complex wheelchairs, adding 215,117, including $82,508 SGF, and add language requiring the state Medicaid program provide reimbursement for diagnostic evaluations, annual preventative maintenance, and add language to eliminate any requirement of prior authorization for diagnostic evaluations, annual preventative maintenance services, or repairs of any complex wheelchair.
I have a recommendation and a second. Recommendation second. Any questions? I thought Representative Ballard seconded, did you not? All right. Jump the gun.
I'll second
I
it.
did too, sorry.
Okay. Representative Rivas seconds. Okay, now discussion. Representative Orpeza.
Thank you. So this would provide preventative care for complex wheelchairs. Is that what I'm understanding without the prior authorization? Is there any, and there would be no limit to the prior authorization, correct?
That is correct.
Okay.
Any further discussion? Okay, have a recommendation, a second. All those in favor say aye.
Aye.
Any opposed? Recommendation passes. Okay, continuing. Representative Steens.
One more for the wheelchairs. Thank you, Mr. Chair. So for fiscal year 2026, for the complex wheelchairs, add language to eliminate any requirement of prior authorization for a complex needs wheelchair. And this might follow along with what Representative Rees had, but hers was for, I know, repairs. This is when the individual has received a prescription, has been evaluated at a specialized wheelchair seating clinic.
Okay, I have a recommendation. Do I have a second? Second. Representative Rivas. Any discussion? Chair has a question. Is this different from the previous recommendations?
So when I believe, and I don't want to speak for Representative Rees, but I believe you said that it was for repairs, correct? And this is for complex needs. So if they've received a prescription from the doctor and they've already been evaluated and they go to the specialized clinic, then they don't need that pre-authorization to get further, like to recommend what their chair is recommended for that patient.
Okay, thank you for the clarification. Any other discussion? Okay, have a recommendation, a second. All those in favor say aye.
Aye.
Any opposed? Recommendation passes. Okay. Representative Rivas, you have a recommendation?
Yes, I do. This came out of the interim committee on sedation dentistry from last fall. This is to change the dental code rate. It would add 1.9 million, which would be $742,610 of state general funds to increase the rate for the dentistry code G0330 from 1,722 to 2,500. This code provides reimbursement for facility fees accrued when providing dental procedures requiring monitored anesthesia. This just gets it in line with the Medicare rate, I believe.
Okay, I have a recommendation. Do I have a second? Yes. Representative Ballard, seconds. Any discussion? I have a recommendation and a second. All those in favor say aye.
Aye.
Any opposed? Recommendation passes. Okay, continue along. Do I have any additional recommendation? Representative Wilcott.
Thank you, Mr. Chair. I have a recommendation to add language to the 2026 fiscal year that the interest earnings transferred from the SGF to the Healthcare Access Improvement Program fund that will not include the interest is attributed to the credit received. In addition, to add language to limit the amount credited to the fund to 80% of the amount estimated to be received by the provider assessment, and that the director of the budget will calculate the amount of interest deposited into the HCAIP for 25 and transfer that amount into 26.
Other lengthy recommendation. Do I have a second? Representative Ballard. No second.
Say second or a question?
Second. Representative King, seconds. Excuse me. Representative Ballard has a question.
Would you explain that? That was kind of complicated. I'm sorry.
This one might be best if Representative Carpenter. Representative Carpenter.
So in the Healthcare Access Improvement Program, there's been interest accruing for the last several years. It's $8.7 million. It's kind of to offset an ask that we have coming up. So we're supplementing. That money will be transferred to the state general fund, and then in one of our other asks, we're going to fund it with a portion of that. So does that make any sense, committee? We're just kind of getting creative, but to try to fund things. But that's basically what it is. There's $8.7 million worth of money that's been sitting there in interest, and everybody found it about the same time, if I may say. So it was going to be swept into the SGF, and we're sweeping it into the SGF, and then we're taking that money back in another recommendation to help fund something that we're going to ask for.
You got to it first, right? Okay. Maybe.
Representative Rivas, did you have a question or further discussion? Okay. Okay, I have a motion, a recommendation. All those in favor say aye.
Aye.
All opposed? Recommendation carries, passes. All right.
Mr. Chair,
Representative King.
I have a recommendation.
Okay.
So recommendation to spend that 8.7 million now. So this is a little lengthy, but basically I have a recommendation to add $10 million for hospitals providing inpatient behavioral health services for adults in fiscal year 26, and add language that expenditures made from the adult inpatient behavioral health services account be directed to Advent Health Shawnee Mission, Ascension Via Christi St. Joseph Campus, Hutchinson Regional Medical Center, Salina Regional Medical Center, Stormont Vale Regional Medical Center, and the University of Kansas Health System, and such expenditures shall be distributed based on the number of adult behavioral health beds available at each facility. And the second part of this is transfer the $8.7 million in interest from the Healthcare Access Improvement Program Fund to the agency's State General Fund account for hospitals providing inpatient behavioral health services for adults in fiscal year '26.
It is a rather lengthy recommendation. Do I have a second? Representative Carpenter. Any discussion? Representative Reese.
Representative King, can you list the hospitals that are going to benefit from this?
Yes, Representative. Advent Health Shawnee Mission. Ascension Via Christi St. Joe Campus. Hutchinson Regional Medical Center. Salina Regional Health Center. Stormont Vale. And the University of Kansas.
Representative Carpenter.
Thank you, Mr. Chairman. And just to clarify, those were the same hospitals that received that $10 million mental health grant last year. So.
Thank you, Representative Carpenter. Representative Rivas.
Yeah, just a clarification. So I heard 10 million and I heard 8.7. So is the 8.7 inside the 10 or are we talking 18.7 total?
8.7 is within the 10.
Okay, thank you.
Representative Ballard, did you have a question?
So there were 7 hospitals. Basically, if we're looking at it, I think you said Shawnee Mission, Advent Health, Ascension, St. Joe, Hutchinson. Oh, okay. Thank you.
Representative Reese.
And how are the funds going to be used?
That's a continuation of the program that they had last year.
Representative Carpenter.
So it was divided up between the 6 hospitals, the $10 million, according to the beds, the mental health beds that they have. Thank you.
Any other questions or discussion? Okay, I have a recommendation and a second. All those in favor say aye. Aye. Any opposed? Recommendation passes. All right, continuing. Any additional recommendations? Representative Oropeza.
Thank you, Mr. Chair. I have a few, but I'll take my turn. I wanted to recommend in FYI 2026 the Medicaid provider centralized credentialing model and add 12.9 million with 1.5 million SGF to implement the Medicaid provider centralized credentialing model. So as we give these increases in rates, we actually have people who are centralized and they can utilize and sign up for Medicaid to provide care throughout the state.
Recommendation, do I have a second? Representative Ballard. Committee, any discussion? Representative Carpenter.
Thank you, Mr. Chair. Although I think I've been after this credentialing for quite some time, it's pretty low on the priority list as far as spending money, and so I would oppose this. I think that KDHE's been working on credentialing, and I've been prodding them along also, and I think they're doing it, but again, it's just not a priority at this time. So with that, I would oppose this motion.
Chair has a question. What was the clarification on the SGF? What was that?
With 1.5 million SGF.
Committee, Representative Wolcott.
Thank you, Mr. Chair. I do have a question. Is this the one that was going to add 3 million every year ongoing, which was item number 8 in 2026 on the budget when they presented it? It'd be page 11 of the packet.
From the revisor's office, Megan?
The difference in cost in the outgoing years is that this first year is for implementation of the program, and in the out years, it actually goes down. So the anticipated cost in the out years are 3 million all funds, and that would be roughly 800,000 SGF.
Thank you.
Committee, any additional discussion?
Give me a clarification. So at 1.5, what is our all funds on that one?
Megan, can you answer that?
The enhancement request made by the agency was for 12.9 million all funds, and that's 1.5 million SGF. This has a higher federal match because of the type of program that it is. And then in the out years, again, it would be 3 million all funds, and that would be about 800,000 SGF, I believe.
Committee, any further discussion? We have a motion and a recommendation. All those in favor say aye.
Aye.
Chairs, any opposed? The chair is in doubt. All those in favor, raise your hands, please. Those opposed, raise your hands. Chair's going to have to vote. Motion fails. Okay, any further recommendations? Representative Oropeza.
Thank you, Mr. Chair. I have a recommendation for FYI 2026 for the Kansas medically needy income limit, which is currently $475. And that this has been requested in the interim through the Bethel Committee to raise it to 100% of SSI monthly to $967. So the ask, the $967 would be monthly, but the ask for SGF would be $940,000 and 1.8 million all funds.
Okay, I have a recommendation. Do I have a second?
Let her have it.
Second, Representative Reese. Recommendation and a second. Any further discussion or questions? All right, I have a recommendation and a second. All those in favor say aye. Aye. All opposed? No. Chair is in doubt again. All those in favor of the recommendation, raise your hand. All those opposed? Chairman's going to vote again. No. Motion fails. Okay. Additional recommendations. Representative Steens.
Yes, thank you, Mr. Chair. I have a recommendation in fiscal year 2026 to add 50 million of all funds, including 20 million from the state general, to increase the base hospital outpatient Medicaid rates.
Okay, I have a recommendation. Do I have a second? A recommendation. Do I have a second? Representative Reese seconds. Okay. A recommendation and a second. Any discussion or questions? Representative Carpenter.
Thank you, Mr. Chair. So could you clarify that, please?
Yes, I'm sorry. I said in fiscal year 2026 to add 50 million all funds, including 20 million from the state general to increase the base for the hospital
The
outpatient.
Medicaid.
That is correct. Medicaid rates, correct.
Representative Carpenter. And I'm not saying that's a bad thing. We put that same amount in last year, and just different environment this year. We're trying to watch our pennies and try to prioritize what we're going to spend. And I'm not saying that's not a valid thing. If we had an unlimited checkbook up here and we were just writing checks, we wouldn't even be having this conversation. But I think that that's a really big lift.
Any further discussion or questions? Okay, I have a recommendation and a second. All those in favor of the motion, the recommendation, say aye.
Aye.
All those opposed? I'm going to do this again. Chair is in doubt. All those in favor of the recommendation, raise your hand. All opposed? Recommendation fails. All right. Representative Oropesa.
Thank you, Mr. Chair. I have an additional recommendation for FYI 2026, and it's to increase the pediatric Medicaid rates to 1 million with SGF and 4.16 million all funds. And this is to align with the Medicare and align with neighboring states. I found it very disheartening, or sorry, I should just continue with that. I was going to make a case for it. Should I wait? Sorry.
We'll come back to you. Okay, I have a recommendation. Do I have a second? Representative Ballard. Okay, questions or discussion? Representative Oropesa, you may continue.
Thank you. And I found it very disheartening that we have our pediatric providers that are saying that they're not going to take children over 5. There are some things that definitely can be evaluated once you're over 5. I know a lot of immunizations and those types of things, basic milestones are hit between 0 to 5. Unfortunately, there's additional things like learning disabilities. Sometimes a hearing disability is not always caught for a child when they're born. In addition to that, really screening for those childhood cancers that are seen from 5 to 10. Those are things that are just needed, and if we don't have providers who are taking Medicaid patients, then those are potentially lost and could end up costing the state more down the line if they're hospitalized and or receiving treatment or depending on kind of what those look like overall. And I'm willing to answer any questions if anybody has any.
Thank you for that, Representative Oropesa. Any questions for the bringer of the recommendation or any other thoughts? Representative Ballard.
I think a case was made for, what I'm really a little concerned about is if you're talking about that young, if that's all they're seeing at this point, but there's so many things that can happen in between, and we're trying our best to get more people to take Medicaid. And what this person indicated was they can't. And if we could make it possible for them, I think it would help a lot of families to have more access. So for that reason, even though I'm sitting here thinking, my goodness, when we go to appropriations, what's going to happen to us, I will vote for it. Thank you.
Any further discussion or comments? Okay. Yeah, Representative Oropesa, can you clarify the amounts?
1 million. It wasn't the full ask amount. All funds, yes.
So for clarification, the ask is $1 million all funds. Representative Carpenter.
I'm unclear on that then. So if that was the case, it'd only be 400,000 in SGF, just saying, so I'm just trying to get clarification here.
Hey, Megan, can you clarify the ask, please, or Representative Oropesa?
I believe the question right now is whether it's 1 million all funds or 1 million SGF. If it were 1 million all funds, it would be roughly 400,000 SGF. And if it was 1 million SGF, it would be roughly.
So, okay, so to clarify, the recommendation is 1 million SGF. Everybody clear?
Yep.
Okay. Any further discussion on the recommendation? Okay. Have a recommendation and a second. All those in favor say aye.
Aye.
All opposed? Motion passes. All right, recommendation passes. Let's move on to the next one. Representative Reese.
Thank you, Mr. Chair. I have 2 recommendations. The first one was brought to us by the Johnson County Health and Environment, recommending or seeking $96,000 in SGF to support TB control efforts. And right now, that is there's a big issue with TB with the outbreak in Kansas City, Kansas, and this will help them to help the health departments in particular to be able to test, provide whatever treatment needs to be provided through that.
Thank you, Representative Reese. I have a recommendation. Do I have a second? Representative Ballard? Any discussion or comment? Representative Wolcott?
Thank you, Mr. Chair. Just to clarify, this is a one-time expense for the 25 budget is the request?
Yes, for the 26, sorry.
26 budget, okay, thank you.
Any further discussion? Representative Rivas?
You can read me. So I guess where I'm wondering is, we're going to have episodic things happen in healthcare. There's going to be blips here and there. Can they adjust their current budget to accommodate these expenses and maybe don't do as much in another area? Because this seems to be a little more in the press as a major outbreak than it seems to be a real outbreak. You know what I'm saying? It doesn't seem to be at that level where we need, I guess starting to fund it now, it may be settled down by the time we get into that budget year. Can we get somebody to address that a little bit for us?
I don't know if there's anyone here from the Johnson County Health.
Probably not. We do have an agency.
I'm just concerned about kind of a gut reaction type of thing.
So Ashley Goss, Deputy Secretary of Public Health. And I'm going to phone a friend, Randy, at the Kansas Association of Local Health Departments. I think when Johnson County asked for that, that was for all health departments. It's for a fund that can address the TB population that don't qualify for other sources of funding. Randy may have more. No? But if I recall correctly, that's what their testimony indicated.
Okay, thank you, Ashley. And either Ashley or Representative Reese. And the ask on that was, what was the price tag on this?
Sorry, it was 96,000.
Okay, thank you.
Yep.
Thank you, Ashley. Committee, any further questions? Representative Steens.
Thank you, Mr. Chair. Yes, I have a question. So I know there has been an outbreak. I know I've been reading about it myself. I think in Kansas City, Kansas as well, and some of those other areas. Do we know what they're spending in the other counties? Okay.
I don't know what it is.
I was just curious.
It's not in their testimony.
Ashley, there's front row seats available if you like one.
I prefer not to have a front row seat. Again, Ashley, Deputy Secretary for Public Health, KDHE. So just to give you kind of an idea, the state of Kansas, so KDHE gets about $457,000 from the federal government for TB. In the state of Kansas, there are 7 counties that are deemed, I don't mean this to sound the way it is, there are 7 counties, though, that are identified with a higher incidence rate of tuberculosis. Wyandotte County is one of those. So the way it works, we receive the federal funding at KDHE, and then we push that funding to those 7 counties on an as-needed basis. So if they have people who test positive for TB and they need treatment, they need x-rays, they need lab, then that funding helps to support that. So we'd send that funding to the health department, and the health department would be able to administer those services. The outbreak in Wyandotte County is much different. We have far exceeded and exhausted all federal dollars. Currently, right now, we've spent just under $1 million on that outbreak. We did have to ask the federal government for additional dollars. They did give it to us in the tune of about $750,000. We have gone through all of that as well. And so right now we're still kind of we're seeing what else we can do. So our award for this upcoming year from the federal government, assuming that it sticks, is $500,000 to administer the tuberculosis program across the entire state. And so that is what I told you going to health departments, but then that also is funding that pays for salaries for our own team, our nurses that are working the tuberculosis outbreak or wherever it may be. So we travel around and we'll do on-site testing or what have you, and it's usually our staff that does that. Does that help?
Can I ask a really quick follow-up? And you may have said it and I missed it. So you said 7 counties. And the total was what again? $1 million? Was it $1 million?
No, the CDC gives us, because we have been considered a low incidence state, so that's how the federal government funds states, is by their incidence rate of tuberculosis. Unfortunately for Kansas, our incidence rate has continued to climb over the last 3 years. But they still look at us as low incidence. So we currently receive just this upcoming year, assuming we get it, would be $500,000. Yep.
500,000.
Yep.
And with that 500, you can disperse it where needed.
As needed, yes. So that doesn't take into account, I think you asked, like, what do we do? Because this isn't, like, this probably isn't just a one-off. This many cases is somewhat of a one-off, and so normally we can handle and manage within our budget, as can local health departments. But if there's another one that occurs, or whatever the next thing is, it's you just don't know. Locals don't have the funding either, so we combine funding streams to try and address the problem.
Okay, committee, before Ashley sits down, are there any other questions for her? Okay, thank you, Ashley. Committee, any further comments or discussion on this? Okay, I have a recommendation and a second. All those in favor say aye. Aye. Any opposed? Chair is in doubt again. All those in favor, raise your hand. Motion fails. Recommendation fails. All right, moving on. Do I have any additional recommendation? I'm going to go back to Representative Oropeza, and then I will go back to Representative Reese.
So thank you, Mr. Chair. I have a recommendation for the Alzheimer's Care Coordination and adding 632,471, including 242,584 SGF, and the language instructing the agency to implement CPT code 99483 to add cognitive assessment and care planning for individuals with Alzheimer's as a reimbursable service within the state Medicaid program.
Okay, I have a recommendation. Do I have a second? Representative Reese, seconds. Committee, questions or discussion on the recommendation? Representative Steens.
Thank you, Mr. Chair. I'm so sorry. Could you clarify that again? So you said for the CPT code 99483 for cognitive
Assessment and care planning for
and
individuals
care
with,
planning.
with
Okay.
Alzheimer's.
And and that's for anybody who who specifically for, is that for care providers?
So it's for, yes, it's for healthcare providers, and it's for younger, it can be potentially for people under 65, young onset, and for, mainly for preventative and accessing and diagnosing. Does that make sense?
It does. And then what was the amount? I'm so sorry.
Add 632,471, including 242,584 SGF. That was the amount.
Committee, any questions or discussion? Representative Reese.
This is for Medicaid recipients,
Correct.
right?
Yes, for Medicaid.
Because Medicaid doesn't really cover this.
Correct. They do not cover
cover the
diagnosis,
planning.
care planning, that type of, unfortunately overlooked for that part.
Okay. Did you have a question, Representative Melcher? Okay. Committee, any other questions or discussion? Okay, I have a recommendation and a second. All those in favor say aye.
Aye.
Any opposed? Recommendation passes. Representative Reese, do you have a recommendation?
I do. I have one big one. This is to recommend $797.8 million in all funds for Medicaid expansion.
That is a big one. Do I have a second? Recommendation and a second. Committee discussion. Representative Carpenter.
I could just about record what I've said for the last 4 or 5 years. Yeah, and guys, I mean, if there's ever a big lift, this is it. So I just hope that folks get it together and vote this down. Thank you.
Representative Reese, the other part of the dance, please.
Yes, the rationale. everyone, and I just, again, every year I say this, I want to commend the chair for allowing us to even have a little bit of a discussion, because it's not allowed anywhere else. Kansas taxpayers are paying federal taxes, which helps fund other states' expansions, allowing those states to draw down a higher percentage of federal reimbursement. A higher proportion of rural mill levies are being used by counties to support local or regional hospital districts that are in those districts. There's about 76 publicly supported hospitals in Kansas. Kansas workers are paying a higher share of family health insurance premiums as part of the employer-sponsored plans compared to those in other states. And Kansas has so far has lost potentially $7 billion in funding due to the refusal to pass Medicaid expansion. Imagine we had that $7 billion, we wouldn't be struggling through all these budgets. Thank you, Mr. Chair.
Thank you, Representative Reese. Committee, any other comments or discussion? Representative Ballard.
Usually this happens when a motion is made to take the money out of the budget, but we're early this year. I will say, we have gone through this many years talking about Medicaid expansion. And I will simply say, as you all know, there are only 10 states out of 50 that do not have it. We know that the majority of Kansans have indicated that they would like to have it. We know that at least 150 would be eligible for Medicaid expansion. And I guess the biggest argument for me is that if we were to do this, there would be a lot of Kansans would be able to sleep at night and not worry, what if I have a major medical issue in my family, or my children need to see a doctor and I don't have money for that to happen. And we have insurance. We don't have to worry about it. But there is a population that worry daily and pray, I would think they do, not to get sick and not to have a major health problem. And we could help in that area. So even though we know you're going to probably vote this down, it has always been worth it to me and to my constituents and even the people in Kansas who are not my constituents, for them to know that I value health insurance. They need it. One of these days, we will do it. But I don't know how many people will be sick, how many people will die in between. And for those of us who have health insurance, it is relief, and you know you don't have to worry about whether or not you will be taken care of, and the people that you love, and even the people you don't know, would benefit from. And for that reason, every time we discuss it, I will just make these comments, because 10 out of 50 is not a good place to be when you're trying to take care of the people in your state. Thank you, Mr. Chair.
Thank you, Representative Ballard, and thank you, Representative Reese, for your comments. Appreciate it. Okay, we have any other comments or discussion, committee? Representative Steens.
Thank you, Mr. Chair, and thank you, previous representatives, for your comments, too. I agree. I want everyone to have health care as well. I think part of the, and I haven't been on this committee, so I know it's something you guys have discussed, it sounds like, over the years. And I think some of and I agree, there are constituents of mine that have talked about it as well. I think some of the pushback that I've heard from people, too, though, is to put more people on healthcare right now when, I worked in healthcare, we are short workers, we are short a lot of people, and I hate that healthcare has become what it is right now because I think patient care is so important and I loved treating my patients. I miss that immensely. But the truth is we just did not have enough providers at all. And so I would really like to push for higher Medicaid rates for doctors, number one, and healthcare providers. Not that I don't hear what the other representatives are saying, and I'm saying this out of my heart and thoughtfulness, and get these wait lists down because I do agree. I mean, I want people to have coverage too. Nobody wants anyone not to have health care. But I know that, our children and those kinds of things that CanCare does cover, and I'm sorry I don't have all that listing in front of me, but I do want to make it quite clear that I do want to push for things to make our healthcare better. And I know there's a lot of things that we need to do. And I appreciate everyone here that's testified in front of our committee, the doctors and our psychiatrists and all of our behavioral health nurses. We appreciate you very much.
Thank you, Representative Steens. Any other comments or discussion? Okay, we have a recommendation and a second. All those in favor say aye. Aye. All those opposed say same sign. All those opposed say no. Let's do it.
No, they said aye.
Well, okay. I can say the chair is in doubt. Chair is in doubt. All those in favor, raise your hand. All those opposed, raise your hand. Recommendation fails. Thank you for the humor, too. And this is my first rodeo. Okay. Representative Steens, do you have a recommendation?
Yes, thank you, Mr. Chair. Okay, I would like to make a motion and ask to make a recommendation out of the committee that the rate for therapy on the brain injury waiver be increased. We had heard here in committee that it's currently at 18.99 per unit. The national average is $35 per unit. We would like a request that it be, I have a couple rates here, 30 being the one I would recommend, but I also have a fiscal note. So can I go ahead and expand on that?
Please.
Okay. So for fiscal year 26, and this includes cognitive, physical, occupational, speech, and behavior therapy. And for a $25 rate, the SGF would be $2,490,730,000. Did I say that right? And then all funds are $6,226,825,000. And then at the $30 rate, the SGF would be $4,562,885,000, and the all funds would be $11,407,212,000.
Okay, so let's stop there. And we have a recommendation on the table. We'll get into discussion. Do I have a second? Representative Ballard seconds. Okay, I have a recommendation and a second. You heard the recommendation from Representative Steens. Discussion, questions? Representative Carpenter.
Thank you, Mr. Chair. While I don't disagree that that's a good deal, it's a good deal of money. And again, we've just on and on and on. This is death by 1,000 cuts. And we just have to be careful with how we spend our money, or we're not going to have any money to do our priorities. So I would oppose this motion.
Committee, any other comments or questions? Representative Steens.
Am I allowed to make a recommendation for the $25 an hour, or does that have to wait?
I don't know that your motion settled on one, so you need to make a recommendation. Let's land on one.
Okay, so can I recommend the $25 per unit?
So there's a recommendation at $25 per
Brain
unit.
injury waiver.
Do I have a second on that?
Yes, but total cost, please.
Representative Ballard requests total cost.
SGF for that would be $2,490,730,000. And all funds, I'm sorry, are $6,226,825,000.
Okay, committee, any further discussion? Okay, committee, any further discussion? We have a recommendation and a second. All those in favor say aye.
Aye.
All opposed? Need better hearing aids. Chairman is in doubt. All those in favor of the recommendation, raise your hand. Okay. All those opposed? Recommendation passes. Okay, do I have any additional recommendations? Representative Oropeza.
Okay, I have a recommendation for FY 2026, the FMAP savings lapse, and adding 9 million FGF for approved projects using the 10% enhanced federal match in FYI 2025. And these funds were reappropriated into FYI 2025 and lapsed into House Bill 2007.
Okay. I have a motion, I have a recommendation. Do I have a second? Representative Reese seconds. Okay, I have a recommendation and a second. Any discussion or questions? Representative Carpenter.
Thank you, Mr. Chairman. So could you clarify what you're trying to do here?
It was for the FMAP's savings lapse because of the 9 million FGF approved for projects. Is that right?
I think this was in Secretary Howard's budget presentation, and this was, and I'm looking to Megan and others, but it was $9 million that the state will wind up paying back, if I understand it correctly. So it's $9 million, and if we don't reappropriate the money, we pay the federal government back.
I thought it was 45 million. Oh, okay, this is a different, okay.
So did that answer your question?
It does,
Carpenter?
thank you.
Okay. Megan, did I misstate any of that, or did I have it correct? Okay, so does everybody understand what we're doing? Okay, let's get the rookie out of it. Megan, you want to explain for the committee?
The agency received $9 million from a federal enhancement to the FMAP, and this money they're instructed to use it in certain ways for home and community-based services. And if it is not used in the way that the federal government has required, then the state will be required to send the money back to the federal government. And this is funding that was lapsed in House Bill 2007.
You have a confused look on your face, Representative Steens. You have a question?
Thank you, Mr. Chair. So I'm just trying to understand. So that's 9 million federal money, but then if it's not used, what did you say correctly, or for specific, is it like designated for a specific? Oh, the home community-based services. Okay. And then that's not appropriated anywhere else. It can only be used for that.
Yes. Everybody understand? We're good? Okay. I have a recommendation and a second. All those in favor say aye. Any opposed? Recommendation passes. Okay. Committee, are there other recommendations that are out there? Representative Rivas.
Thank you, Chair. Yeah, this is not a big one. It's dental, but it's the last thing I'll ask for. Just give me what I want and I'll go away. This is for FY26. It's donated dental services. So historically, the state's funded $70,000 a year to help with the administration of this service. And what it is the dentists across the state volunteer and do charity dentistry. And this money helps offset the administrative costs. The costs are actually about $125,000 a year. So the ask is at no less than 70. I want to keep the 70, but I would like to ask for an increase of 55,000 to make it 125,000 just to cover our cost to administer this. It's being supplemented by charitable donations right now that could be used in other ways towards the care.
Okay, I have a recommendation. Do I have a second? Representative Steen seconds. Clarification, Representative Ballard.
Well, it's a proviso, I think. So every year you have to ask, right? So I think it's an ask for 125. The historical ask has been 70. Am I saying that correctly?
I believe so. Okay. So incrementally, it's
55,000 additional.
And I'm looking at Megan here to see if she can.
I'm a new guy, so make sure I'm saying it right.
There's a lot of that here. Megan, do you have clarification on that?
I'm not familiar with this being funded in the current budget. This was a public testimony item. The agency might have information about that. But it sounds like,
Network is the name. Maybe under Dental Lifeline Network.
Okay.
Kevin could probably give us clarification.
Don't know if there's anybody here from the, that can, do we have someone? Kevin, can you respond to this one, please? Thank you.
Respond, I don't know that I know the answer. It's my understanding that $70,000 was already in the budget, and it would be an additional $55,000. But I don't know where it is in the budget, Megan, so I don't know where that is defined. So I don't know if Deputy Secretary Goss knows. I don't know the answer. But she could be in the front row.
Okay, Kevin, thank you so much. Deputy Secretary Goss, would you like to come back up, or you're waving us off? Okay. Megan, do you have any additional information on there? Can you find anything on it?
Oh, yeah, it's been there for years.
Okay. Okay, so we'll go with the assumption that the 70,000 was in the budget and that the incremental is 50,000, 55. I think that is a general assumption, is that it was in the budget somewhere. We just haven't located at this point. Okay, so I have a recommendation. We had a second. Committee, any further discussion or discussion? Representative Rivas, you want to add some clarifying?
What this does, what's been the 70 for years, what this does, it basically will enable us to probably get more dentists enrolled to do free care. So there's labs that donate care, and the dentists donate their time and their care. So people that fall between the cracks, this has been great. I participate, and I've seen several patients this way, and it really does fit a niche that's beneficial. And we're talking millions of dollars of care for $125,000.
Okay, so committee, everybody square on what we're about to vote on? Okay. Got a recommendation and a second for donated dental services. All those in favor say aye.
Aye.
Any opposed? Recommendation passes. Okay, committee, any additional recommendations? Representative Reese, do you have any? Representative Carpenter.
Thank you, Mr. Chair. I have a recommendation here for $253,684 SGF for the Stan Clark Pregnancy Maintenance Initiative in 2025. These funds were reappropriated into 2025 and lapsed in House Bill 2007. And I can give some details on the program as soon as I get a second.
Okay, committee, I have a recommendation. Do I have a second? Second from Representative Steens. Okay. Questions or clarification?
Yes, clarification.
Discussion?
So the purpose of the Pregnancy Maintenance Initiative PMI program is to provide services to pregnant women to enable them to carry their pregnancies to term. The PMI program uses a team approach that includes a pregnant woman, a case manager, and a network of related service providers within the local community. The primary goal of the program is to provide case management services for pregnant women to increase ready access to appropriate prenatal care, thus improving positive pregnancy outcomes for women and their babies. It's been in the budget for, I have no idea how long. I think it started like in the 90s. And the funding was lapsed out of there, and this is just to refund it.
Chair has a question. What was the price tag on that again?
$253,684.
Okay, thank you. Okay, committee, you've heard the recommendation. You heard the question? Representative Reese.
Thank you. Representative Carpenter, is that the, I know the fund. And is it last session we gave fund to pregnancy clinics that are all across the state? And are these two separate funds we're talking about?
Yeah, I can't speak to what we did last year, but these are two separate, totally separate funds.
Like to see those combined some kind of way. Yeah.
So the question, so for clarification for the committee, do you have
was one.
clarification, Representative Ballard?
A senator who passed away tragically, it was named in his honor, Senator Stan Clark, and that's why I was trying to get the figure, was this his account that has been around over 25 years.
Okay, committee, any further discussion? So I have a recommendation and a second. All those in favor say aye.
Aye.
Any opposed? No. Recommendation passes. Okay, committee, any further? Representative Carpenter.
Thank you, Mr. Chair. I saved the most complicated for last. I guess first I'm going to back up here. Medical, I'm going to make a recommendation for the medically needed income limit, changing it from 475 as requested by the interim Bethel committee to 100% SSI, for $967 a month, 940,000 SGF, 1.8 million all funds. And my recommendation will be that KDHE provides that to us, the funding for that out of existing resources.
Okay. I have a recommendation on the table. Do I have a second? Representative Oropeza. Recommendation and a second. Committee, discussion or questions? Representative Rivas.
You want to define the existing resources at the current budget, or?
No.
Okay.
There's money out there, and if they need some help finding it, I'll find it for them.
I appreciate that.
Okay.
Representative Steens. Oh, okay.
All right, that's, may I?
Representative Ballard.
1.8 million? Or was there another amount? Because I heard two.
For clarification, it's 940,000 SGF.
Yeah.
Committee, I have a recommendation, a second. All those in favor say aye.
Aye.
Any opposed? Recommendation passes. Representative Carpenter, one more.
One more, and it is the most complicated one. Many of you probably know we have what we call HCAP. It's where the hospitals tax themselves. And then Jill, you want to explain? Thank you, Jill. Oh, what were we saying?
Advisor has language to hand out.
Yeah, and it needs it, and it'd take us an hour to understand it even after we read it. It's very complicated. Anyway, so the bottom line is we'd been doing, in the hospitals, we'd been taxing ourselves. It's perfectly legal. It's called a provider tax. The nursing homes do it also. They tax themselves, and then you bring down federal money that way. Well, we had done it for a number of years. Matter of fact, I carried the last bill that we did. It was 3% on the floor, but it's also potentially germane to Medicaid expansion, so we haven't been running the bill. But it's in last year's budget was this deal, and we've applied to CMS for this change to up to 6%. Now, what's different about this one is versus last year's is that the critical access hospital, before it was limited to a certain amount of hospitals that agreed to tax themselves, the higher ones. And I can't remember what the exemption was that they taxed themselves, but it was a certain amount, like $8 million. If they did less than that, they didn't pay the tax. Well, they've agreed now to tax themselves to bring down even more money. So that's what this changes in there is. Different than last year's proviso is it allows them to tax themselves at up to a 6% rate, and the critical access hospitals are coming on board. And so that's what this does. And I have slept a couple of times since I remember Megan, do you have any idea what the fiscal note is on that HCAP? It was $400 million? Right, but I mean, it brings down for the hospitals, I forgot what it was, but it brings a lot of money back into the state for the hospitals. So that's the difference. And then the other thing is, this is upon CMS approval. So we're asking for it and through their approval process, and we'll bring down, I can't remember what the fiscal note on it, but it's pretty significant money coming back to our rural hospitals and all hospitals.
Looking, you're right, this is complicated. I guess while Megan is looking this up, committee, any other questions for Representative Carpenter that he might add? Representative Rivas.
So should this contain a percentage or any kind of a ratio or anything like that?
I believe that it does contain, I thought it was up to 6%.
Is that within the KSA?
Jill, do you have information on that?
So it's already in the bill, the 6% increase is already in the bill on page 122 in section 75J. Already has the agency to submit to CMS the increase of the hospital provider assessment rate to not greater than 6% for the inpatient and outpatient net operating revenue. And then what this does is there's a provision of law that says this doesn't apply to critical access, this assessment doesn't apply to critical access hospitals or rural emergency hospitals. And what this would do is say it would apply to those if they're over the rate. So I think of it in my mind as larger hospitals, larger critical access, larger rural hospitals. But that amount would be set by the Healthcare Access Improvement Panel.
So Megan says it brings in about 200 million.
Committee, any further questions or discussion? Excuse me. So I have a recommendation and a second. All those in favor say aye. Aye. Any opposed? Recommendation passes. Okay, committee again. Do I have any further recommendations? Seeing none, I want to thank everybody for your time and your patience today. We stand before we adjourn. That. All right. Thank you, Jill, for that all stop. Committee, I move that the Committee on Social Services budget recommend to the House Committee on Appropriations to adopt the appropriations for Kansas Department of Health and Environment for FY25 and 26, I think, some of these, as amended and as provided in House Bill 2007. Do I have a second? Second, Representative Oropeza. All those in favor say aye. Aye. Any opposed? Motion passes. Okay, so committee, before we do adjourn, just real quick, I would encourage you to maybe heed some of the words of Representative Ballard and Carpenter. If you have some time, watch the Appropriations Committee meetings. We've done some heavy lifting in here today. I will do my best with the recommendations that we put forth. I cannot guarantee you that everything is going to get across the finish line. And the other thing that I would say is know that our counterparts in the other chamber, the Senate, are going to be working on these things too. So at some point, all this is coming together through appropriations. Process isn't over. There's other things that can happen in the Appropriations Committee, but this is a big one for this agency, and I want to thank you for your time today.